Hello, my name is Robert Sickels. I am a senior shareholder and a partner at the powerhouse law firm of Sommers Schwartz, where we focus on personal injury cases, product liability, employment disputes, class actions, and more. I have the great pleasure of being joined today by Dina Zalewski, who is a partner as well and a dear friend. We're going to talk about a very compelling topic, delayed diagnoses of cancer. And Dina has a considerable background in handling these types of cases, and she's going to talk to us about some of the cases and about the topic in general. So let's start with basics, Dina. What is a delayed diagnosis of any medical condition?
Yeah, thanks, Rob. A delay in diagnosing any condition, but specifically a cancer case, would involve the failure on the part of a doctor to diagnose a cancer when there was an earlier opportunity to do so. And I think a lot of the time there's a presumption that if there was a delay in diagnosing a cancer, it means that there was automatically medical negligence. And I think that that's a reasonable assumption that most people have. But as I think we're going to talk about today, it really depends on the delay. It depends on the type of cancer. It depends on the cancer cell type and a whole lot of other things before we know whether a delay in diagnosing a cancer is actually going to translate to a medical malpractice lawsuit, which is what this is all about. And I think you would agree with me that delays in diagnosing cancer cases are really more difficult to prove the causation aspect. And that is the part of the case where we have to show an earlier diagnosis could have made a difference.
So give us some examples of diagnostic delays. What kind of diagnoses or what kind of medical screening occurs where there is a delay?
So, common delays are usually caused by radiology misreads. For example, radiologists are specialists who are specializing in reading films like CT scans or MRIs. And if they look at one of those scans and they improperly report that everything looks clear and that there is no cancer, that can result in a very long and dangerous delay to the patient. Another example of a delay that I've had recently is a delay on the part of the clinician. So, in my case, it was a primary care physician who did receive a report from the radiologist that there were concerning signs and symptoms of a mass seen on a kidney and that needed to be worked up. And unfortunately, it wasn't. And so the delay was on the part of the primary care physician in that particular case for not taking the radiology results and recognizing that there was a mass that needed to be worked up. And then, of course, there's other delays. And I think you've actually handled some of these cases recently where they're pathology delays. So, pathologists are specialists who take the actual pathology from a procedure and view it under a microscope. And their job is to look at those cells and report back whether they're cancerous or not cancerous. And if they report that everything looks clear and that there's no cancer, that can obviously result in a very serious delay as well.
What impact does a delay have on a patient's medical course? And how significant or how long must the delay be in order to have an impact?
Yeah, that's a great question. Obviously, we live in a world where everyone understands that early detection, early treatment is key to a better prognosis and a better outcome. And there is a presumption, I think, when a lot of people have a delay case that it's automatically going to be a case. It's what I was alluding to at the very beginning. But for example, if you have a 3-month delay or a 4-month delay in diagnosing a really aggressive cancer, that's going to be a case that's difficult to prove because chances are the medical literature is going to support the fact that even if your cancer would have been diagnosed 3 months or 4 months sooner, it would not have been significant. But in situations where you might have a radiology delay, that causes a 2-year sort of wild goose chase and figuring out what's going on with the patient, a 2-year delay is going to be extremely significant. And most literature is going to help us prove that earlier diagnosis situation, more likely than not, would have made a difference in outcome to that patient.
I recently have handled a case where there was a 6-year delay in recognizing that a study done on a patient for a head CT because he was dizzy actually revealed a mass in his lung, but the radiologist was just looking at the head and wasn't looking at the entire study and failed to report that there was a mass in this individual's chest. And over a 6-year period, this mass grew to enormous proportions. And unfortunately, by the time it was diagnosed and the mass was removed from his chest, the die was cast and he died not long thereafter. Do you have similar examples in cases that you've handled that exemplifies or illustrates the impact of a delay on a patient's medical course?
Yeah, absolutely. The kidney cancer case that I was referencing earlier is a case that I resolved last year. And in that case, there was an incidental finding, meaning the CT scan that was being done was for a completely different purpose. But the radiologist, while looking at that CT scan, did acknowledge that there was a mass seen on the patient's kidney. And that report made its way to the primary care physician. And the mass really needed to be worked up. In radiology lingo, usually they don't say the word mass unless there's something very concerning. And because we had that early study, we were able to see that there was no lymph node involvement, that it had not spread anywhere. And so we were able to prove that at that point, had it been diagnosed, it would have been a resection only, meaning only surgical intervention would have been required without any chemo or radiation for the patient. And unfortunately, that's not what happened. I always say those cases are supposed to be the lucky ones. Like those patients are supposed to be the lucky ones where you have an incidental finding where you can make a diagnosis early. But in her case, the diagnosis was made almost 2 years later, and it was stage 4 kidney cancer by that point. It had spread, it had metastasized to several other organs, and it was no longer curable, and she carried a very poor prognosis. And thankfully, I was able to resolve the case while she was still alive.
But how tragic nonetheless, which leads to the question, what are the categories of damages that are recoverable in a case involving a delay in the diagnosis of a specific form of cancer?
Yeah, so cancer cases are medical malpractice cases. Michigan has caps on non-economic damages, unfortunately. At this point, at least, we still do. There are lower tiered caps and higher tiered caps for non-economic damages. That means anything that you can't put a price tag on. So the patient's pain and suffering, their mental anguish, everything that they're going through. In our state, that's capped. And that is one category of damage that you can pursue. Usually that is the most emotional portion for most patients, but it's not the portion under our laws that give the patient the most recovery. The second category of damages would be economic damages. So if the patient was working, for example, and they're no longer able to work, and we can show that there was wage loss, or if the patient is required to pay out of pocket for medical treatments or medical expenses as a result of their cancer diagnosis, that would also be an economic damage that would be part and parcel of the case. Those sorts of damages are called economic because you can put a price tag on it. And unfortunately, in death cases, there's a different analysis. We're fighting for the heirs of the decedent. And in those cases, we are asking for damages to compensate the loved ones for their loss of society and companionship and the love of their loved one.
You mentioned Michigan. I'll just remind, or maybe the viewers don't know, but we also have offices in California and Georgia, and we handle cases all over America. Are there or are there examples of systemic failures that lead to delayed diagnosis of cancer?
Yes, absolutely. I keep going back to this case, and I think it's so fresh in my mind, but the systemic failure in my kidney cancer case was the fact that we had a incidental finding that was timely and properly reported. There was information passed to the primary care physician. The primary care physician time-stamped receipt of the results, so we know that they were received in a timely manner. And then subsequent to that, everything fell through the cracks within the internal system of the primary care physician's office. Scheduling never got any sort of request from the primary care physician to follow up with additional testing. Electronic medical records, Rob, is everything's a ticker tape in these medical records. So when patients go into an office, the history from the previous visit kind of carries over into the current visit. And the results of that MRI never made their way into the chart. And so everything slipped through the cracks because of just an overall systemic failure.
So, take us through the process of working up a delayed cancer case from the point where the client or the potential client comes to you and tells you about their experience.
With a delayed cancer diagnosis case, you have to go back to the beginning. When is the time frame that the client thinks that they could have and should have been properly diagnosed with their cancer? It's really important to come in and sit down with patients because you don't get the same sort of information over the phone as you do in person usually. I like to sit down with the client and ask them to go through the chronology of their symptoms, their office visits, and get a sense of what was going on back then when they were first reporting their symptoms. And then we have to dive deep into the type of cancer that they have and make an analysis with the help of our medical experts, of course, because this is not something I'm capable of doing on my own. I need the help of qualified medical experts to help me decide whether a cancer diagnosis could have been made sooner and whether it would have made a difference. And then once you identify that type of cancer, that cell type, their symptoms when they believe they could have and should have been diagnosed, it becomes very important and critical to the viability of the claim to figure out if there's literature to support the fact that intervention at that point or a diagnosis at that point, more likely than not, could have changed the patient's outcome. And that is the most difficult part in cancer diagnosis cases for sure.
You mentioned systemic failures, which reminds me of a case I handled many years ago where a woman underwent a radical hysterectomy and removal of her ovaries in tubes because she had been told that a biopsy of a small nodule was positive for uterine cancer. So when we took that case in, we did a workup, we obtained the slides, and we obtained all of the protocols in the pathology department. And what we discovered was that her biopsy slides and the biopsy slides of a different patient were mismarked, mislabeled. And as a consequence of that mislabeling, she was told she had a very aggressive form of uterine cancer and underwent a very radical operation involving all of her reproductive organs that she never needed. Quite fortunately, we were able to resolve that case as soon as we pointed out to the institution the mix-up in the pathology lab, but it was a systemic failure on their part. Dina, tell the viewers or explain to the viewers, are there time limits on when a delayed diagnosis of cancer case can be brought in court?
Yes, there are. The general rule for medical malpractice cases, at least with respect to Michigan, that's where I will focus right now, is that there's a 2-year statute of limitations on medical malpractice cases, and that's 2 years from the date the medical malpractice occurred. It's not 2 years from the date that you learned of the malpractice or from the last instance of what you think was the malpractice or anything like that. That 2-year ticks by really quickly. There's exceptions to the 2-year rule, and my experience is most of the time, cancer cases are the types of cases that fit under that exception because we have a 6-month discovery rule in Michigan that as long as you do not exceed, it's complicated, but the 6-year statute of repose, you can still bring a claim as long as you can prove that you had no way of knowing that there was a malpractice claim. And you have to do so within 6 months of discovery of finding out. So a really good example of that are radiology misread cases. So a radiologist misreads an MRI or a CT scan. They report back that everything's okay. You find out almost 2 years later, or sometimes after 2 years, that the radiologist misread that CT scan. You have 6 months from the date that you learned of that misread that occurred 2 years prior to file a lawsuit. And in some cases, if you can actually meet those requirements. So very important that if you think you have a case or your loved one has a case, that you call a medical malpractice attorney immediately and find out if you still have time to file a lawsuit.
That would be you.
That would be me.
And our firm, which has a great collection of very experienced trial lawyers who are expert in handling delayed diagnosis cases and a full myriad of medical malpractice cases. So there is no reason to delay, and there's good reason not to delay in contacting our office. We offer free consultations. So thank you very much for being with us today. And with that, I will sign off. Thank you.
Thanks, Rob.